Welcome back. From back pain and arthritis to weak bones, stiffness and mobility challenges, many people silently struggle with conditions that can greatly affect their daily lives and overall quality of life. But the good news is that with the right knowledge, lifestyle habits and medical care, many bone and joint problems can be prevented, managed or treated effectively. To guide us through this important discussion, we are honored to have with us a highly respected consultant orthopedic joint replacement surgeon. Ladies and gentlemen watching us outside, inside the studio and everywhere, welcome with me Dr.Ishaq Ojodu. Let's give him a
thank you very much.
Welcome, doctor.
Thank you very much.
welcome.
And then I saw that you were the one coming. I was actually very excited, because you see this bone issue, arthritis, like you really said, the joints, it is everywhere. In fact, sometimes you sleep, wake up, and one hand says, "We are not going anywhere today." You'll be feeling pains. So it's good to have you, and we know that you're going to expatiate on this issue.
Yes.
All right, doctor, we have limited time. Now talk to us. There are some people that, all their life they've had nothing. They didn't even have accidents. Like me, I had domestic accidents severally, but they didn't have accidents. They didn't have, all of a sudden they woke up one morning and leg is like, what's going on? The arms are like, what's happening? The back is like, what is really the cause of this, and how can it be prevented, and how can it be prevented?
Okay. Thank you very much. Bone health. We'll start with bone health. Or let's start with what is bone. Okay. Bone is a living organ. Okay, like you have the kidney, you have the liver, you have the heart, you have the brain. Also, bone is a living organ that supports all these systems I've mentioned. Okay, it allows us to move, it protects these organs, and it also produces some minerals, okay, that helps in day-to-day activities as we move on. So the first thing about bone is that there is a mass, a critical mass that must be accrued from childhood to adolescence. If you fail to meet that peak, then you are setting yourself up for what we call fragility fractures or osteoporotic fractures. The bone mass is becoming known. And that's why I said it's fragility fractures.
Fragility factor.
You don't want osteoporosis.
Osteo is
the same thing. Just the medical term for fragility fractures. So you are setting yourself up for fragility fractures. So in essence, the bone mass must be focused upon as a child is growing up. Okay. In the adequate intake of calcium, adequate intake of vitamin D, exercise, and good nutrition. These are the components of the bone health. Okay, so a child, for example, for a male, the critical bone mass will be achieved at the age of 17-18. Whereas for females, the critical bone mass will be achieved around 15-16. Okay, so as I said before, if they fail to achieve this critical bone mass, then there is a possibility in future that the bone will become weak and is prone to pain, for joint pains, back pain, and then easy fractures. You can just strip and then you break your hip, or you break your back, or you break your hand. Okay, so that is the cause or the major reason why people develop osteoporosis or fragility fractures in adult life. So
sorry doctor, how do you find out if you have attained the critical mass? So
the critical bone mass is assessed by what we call DEXA scan. It's like MRI. It will tell us, there are scores that we look at, the T score, the Z score. We look at it and then tally it to a table. Okay, normal values have been agreed upon.
Okay.
Then if you are below that, if you need to take some medications, some lifestyle changes, we will tell you. So, but it's not for everybody. That assessment is not for everybody.
Okay.
There are some people that are high risk of developing low bone mass. Okay, female gender, they are prone to it because of the estrogen. As you age, the estrogen level decreases and the bone mass also decreases. So it is very, very instructive or advisable for all women, especially above 50, to add additional calcium and vitamin D to their diet, or take it as supplements. Okay, so that will also enhance the bone formation, because the bone is in the process of breaking down and forming, resorption and resorption. That is, the bone is being removed and the bone is being formed. So if the resorption is more than the formation, then you have osteoporosis. So what you intend to do is to make sure that the formation is more than the resorption.
Okay, let me ask. I have a 16-year-old girl.
Okay.
And I know that since about 5 years ago, once in a while she say, I'm moving my leg. I always ignore and say, please don't let me hear it too. Just don't.
You're too young for this.
I said, don't let me hear it. Say, I'm moving my leg. But once in a while the pain comes, so much. I say, okay, go and rub this, go and take analgesic and all of that. So, what do you think is happening there? She's never had, a major injury or something. And she's just a little girl.
You said 16.
She's 16, but I think it started about 5 years ago. So in younger, because most times you see in older people, say because they're aging, their bones are aging and all of that. But this is a girl that is still very active. She does sports a lot, and I know that a few young people also, I've come to your clinic and I've seen young people,
I even wanted to interject when you talk. Say it's not more from 50 something. Now you see very young people having
what is
body
the
pains.
issue? What's going on here?
Okay, so there are many causes for somebody to have bone pain. The commonest cause is hereditary, genetics.
Okay.
You inherited the genes from your parents, from your grandparents, and all that, the family lineage. That's number one. Number two, there are some other conditions that could cause bone pain or joint pain. Apart from osteoporosis, there is what we call osteoarthritis.
Okay.
Osteoarthritis simply means the removal or the reduction of the cartilage, which is the covering of the ends of the bone. Loss of that cartilage will result in osteoarthritis. There is also what we call rheumatoid arthritis. This is an autoimmune disease in which the body is attacking itself. Okay, it's an autoimmune disease. So it can occur in a child, it can also occur in an adult. Okay, that's number two. Number three is what we call gout. From what we eat, the uric acid accumulates and is not able to be flushed down to the kidney. Okay, and that becomes deposited in the joints, and that will also lead to pain. Okay, so or the person has had injuries that he or she overlooked in the past. If it's not properly managed, it becomes a chronic pain. Pain that will last, it will come again, it will resolve, it will come again, it will resolve. So my advice is that the person should seek for a medical intervention. Okay, then they will take the history, they will examine, they will request for necessary investigations, and they will come to a conclusion or diagnosis, and they will now treat.
Okay. So my daughter needs to come to your clinic now.
Yes. Yes.
Oh my God.
Yeah.
So now let's is there other than, taking all of these precautions now, at the end of the day, somebody is down with this. What happens? Is it curable? What happens?
You manage for life.
Yeah. So for osteoarthritis, once it starts, you cannot cure it. It can only be managed. Okay. So the earlier you present to a doctor or an orthopedic surgeon, the better the outcome. If you present early, you go through the necessary intervention procedures or treatments, then the outcome will be better. Or if you come late, then the outcome is guarded. So let me just go through the treatment for osteoarthritis, for example.
Okay, please go. I know you talked about what it is, so you start off with what it really is.
Yeah.
How you know you have osteoarthritis.
Okay, so for osteoarthritis diagnosis, the patient will complain of pain, joint pain,
Okay.
and this pain is going on and off, on and off, on and off. That's number one. Number two, you could have joint stiffness. Your joint is stiff. You cannot straighten it. Or sometimes you feel that this joint is swollen. Or there is warmth. The temperature of that joint is different from your other joints. Okay? So if you have any of these features, we'll ask you to do an X-ray. So X-ray will show the level or the stage of the osteoarthritis. Okay, you have the stage 1, stage 2, stage 3, stage 4. So stage 1 and 2 are the early stages.
Like cancer.
3 and 4.
Jesus
no,
Christ.
this is not like this is not the cancer.
Jesus Christ.
But this is manageable. This is manageable. So 3 and 4 are the late stages.
Extreme.
Yes. So for the stage 1 and 2, we advise you to do lifestyle modification.
Okay.
If you are sitting too much, walking too much, you are stressing yourself too much, we advise you to calm down. If you are overweight, so there is what we call body mass index. That we use your weight and the height. If you are above the normal threshold of 29, so some people are overweight, some people are obese, some people are morbidly obese. Okay, so your weight also contributes to the stress on the joints. So you need to also take care of your weight. Number 3 is that you also involve yourself in physical activity. The more you move, the less you pain, the pain that you are going to be having. So you need to develop the muscles around these joints. If the muscles are weak, then more pain will come from that joint.
Okay.
If the muscles are strengthened, less pain will be coming from that joint.
Okay, doctor, let me ask you this, because I know that I want to come to the myth and misconception, but before that, I just don't want to forget this. I know that oftentimes, when you have pains like that, people would say, oh, go to the gym, get to the gym, enter the gym and all of that. And I remember that when I visited you and I said to you that when you saw the X-ray, you said it's not that bad, why are you having this so much pain? So I know along the line when we were discussing, I said when I go to gym, I said we are going to the gym. We said if you want to lose weight, work on your diet. I know I remember you said, so that's the mental something behind our brain, that if you have any sorts of pain, go to the gym, go and pressure it and all of. And I know that since I stopped the gym, it's been better. So apparently I realized that even the pain from the gym is so. Tell us about this idea of going to the gym, and it's like we mix up physiotherapy and the gym. Talk to us about it.
Okay, so for bone health or to relieve joint pain, there are some certain exercises that you are supposed to do. It's not what you do in the gym.
You can do it in
your home. You can do it. You're walking alone. It's also part of it. Jogging, dancing, swimming. All these are all different type of exercises that you can engage in.
Dancing.
Yeah.
I like that one.
Yesterday, because last night I was just feeling funny. I said, okay, let me try dancing. Doctors, at that point I knew that the dancer girl that of yesteryears cannot even dance and go down. But I felt a lot better.
Movement is life. But you must not do it in extreme way.
I was coming there because I hear you say that this work because this one you go to gym. This work I say walk. Don't walk too much. Don't jog too much. Don't
It must be in moderation. It must be under the supervision of an healthcare practitioner.
Oh, really?
So you can't just say I want to do this exercise. I want to lose weight because I need to do this, and you enjoy yourself more. Okay. So ordinary walking 3 times a week. Okay, maybe 1 kilometer. You can increase it as your body can tolerate it. Jogging, you can swim. Swimming is the best for all the joints in the body. Okay. So all these exercises are geared towards improving the muscle strength and the bone. Okay, so if you don't do the appropriate exercises, you are going to have a worse outcome.
Okay, let's go to the myth. Honestly, because before my director start coming on me, let's go to the myth and the misconception. I hear people say, hey, you have arthritis, don't drink cold water.
No, that's a myth.
You go, be pouring hot water. Tell us about all of this.
So for thermal treatment of joint pain, we use cold ice or ice block.
And my old mommy still will say pour boiling water on the leg.
No, if the pain is less than 3 months, for acute pain, we use something that is cold. For something that is more than 3 months, we use something that is warm.
Oh, really?
Okay. So, but in addition to that, you need to pay attention to what I've discussed before. Exercises, loss of weight, stopping smoking, alcohol. All this contributes to.
So it has something to do with I'm coming from the hot sun and I feel like making cold water.
It has nothing to do with that.
As much as you like.
It's just misconception. Pure misconception.
Okay, let's quickly, before we let you go this morning, what is one simple habit everyone watching today can start immediately to improve their bone and joint health? Okay.
First and foremost, you must know your health. You must know your health. You must know your health. Okay. So if you are overweight, you must know your values, your units, your weight, your height. You must know that. If it is high, you must bring it down. And one of the simple things to do is to eliminate dinner after 7 o'clock.
Amen.
And then solid food after 7. So your last meal must be between 6 and 7. And you must wait at least 3 hours before you go to bed. That alone will cut off at least 20-30% of your weight. If you can adhere to that.
But what about those of us that, yes, you are eating at 7 o'clock, but you are still sitting down there and you are still writing script for morning ride tomorrow. You are still going to read up and you are there for the next 3 hours. You've not stood up for any exercise. Is it still okay?
Yeah, you can drink water, you can drink tea.
No, what I'm saying is that because most times they say when you eat you stand up and
Yes, but once you eat you must walk around.
Do some movement.
Move.
So if you don't move,
you are allowing those food that you have eaten to be converted to fat. But if you move, you will quickly metabolize them. You will quickly make use of them. So the body will not convert them to fat. Okay, so that's number 1. Number 2 is that you must exercise. Involve in regular exercises at least 3 times a week.
Not rigorous.
Not rigorous. As I said, walking, jogging, dancing, as the case may be. So you can interchange it. So this week you want to walk, another week you want to jog, another week you want to swim, and like that. So regular physical exercise. Next one. The third one is that you must avoid all the other things that will contribute to ill health or that will affect your bone health. Smoking, then excessive alcohol intake. Okay, you must go away from that. Then lastly, nutrition. You must pay attention to your nutrition. You must take enough calcium, you must take enough vitamin D, and you must have good sleep and stress management. These are all what contributes to bone health issues and joint pains.
Oh my God, it's been a good time with Doctor. We appreciate your time. We know that you are very, 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 very busy. A busy surgeon. I know that you had to squeeze the time out to be here, and we just had to do this because we have a lot of people at home that needs this. But then, and one thing that I can take away from here is that there's management for whatever kind of arthritis you have. So don't wait until it is too late. See a doctor. It's better to do something than to do nothing. Thank you so much. We have been discussing with a consultant orthopedic joint replacement surgeon. He is Dr. Ishaq Ojodu. Thank you for coming here this morning.
You're welcome. It's my pleasure.
Okay, so we will go on a break right now. We will return with our next guest. Don't go anywhere. Stay with us. We'll be right back.